Welcome to 60-Second Nursing, Gynecology Chapter Number 2, En-Clex Rapid Revision. Question 12. Endometriosis. A client with endometriosis reports severe pelvic pain. What is the priority nursing diagnosis? A. Risk for infection. B. Acute pain related to inflammation. C. Anxiety. D. Imbalanced nutrition. Answer is B. Acute pain related to inflammation. Rational endometriosis causes severe cyclic pelvic pain from ectopic uterine tissue. Danger: uncontrolled pain impacts activities of daily living and must be managed first. Memory click: endo equals extreme pain. Question 13. PCOS. A client with PCOS is at risk for which complication? A. Hypoglycemia. B. Endometrial hyperplasia and cancer. C. Hypotension. D. Bradycardia. Answer is B. Endometrial hyperplasia and cancer. Rational PCOS causes anovulation and unopposed estrogen, leading to thickened endometrium. Danger: long-term risk is endometrial cancer without regular shedding. Memory click: PCOS equals persistent lining. Question 14. Clomiphene. A client is prescribed Clomiphene for infertility. What is the priority teaching? A. Take with food to prevent gastrointestinal upset. B. Report visual disturbances immediately. C. Avoid all activity. D. Expect weight loss. Answer is B. Report visual disturbances immediately. Rational: Clomiphene can cause visual changes, a sign of toxicity. Danger: visual changes mean the drug must be stopped to prevent permanent eye damage. Memory click: Clomid equals check your eyes. Question 15. Epidural. A client in labor requests an epidural. What must the nurse assess first? A. Cervical dilation. B. Blood pressure. C. Fetal position. D. Maternal age. Answer is B. Blood pressure. Rational: epidurals cause hypotension. Baseline blood pressure must be stable before placement. Danger: hypotension reduces placental perfusion and can cause fetal bradycardia. Memory click: epidural equals evaluate blood pressure. Question 16. Mastitis. A client with mastitis should be taught to do what? A. Stop breastfeeding. B. Apply heat and continue breastfeeding. C. Apply cold only. D. Restrict fluids. Answer is B. Apply heat and continue breastfeeding. Rational: heat and continued emptying of the breast resolves mastitis. Danger: stasis can lead to breast abscess. Memory click: mastitis equals milk must flow. Question 17. Missed abortion. Q. A client with a missed abortion at 12 weeks should be assessed for what first? A. Emotional support needs. B. Signs of infection and bleeding. C. Fetal heart rate. D. Nutritional status. Answer: B. Signs of infection and bleeding. Rational: a missed abortion can lead to DIC or sepsis if tissue is retained. Danger: infection and bleeding are life-threatening complications. Memory click: missed equals monitor for sepsis. Question 18. Uterine fibroids. Q. A client with uterine fibroids reports heavy menstrual bleeding. What is the priority nursing action? A. Assess hemoglobin and hematocrit. B. Encourage fluids. C. Administer iron without labs. D. Teach Kegel exercises. Answer: A. Assess hemoglobin and hematocrit. Rational: heavy bleeding causes anemia. Labs determine severity and need for transfusion. Danger: severe anemia can cause heart failure and fainting. Memory click: heavy equals H&H. Question 19. Medroxyprogesterone. Q. A client is prescribed medroxyprogesterone for contraception. What is the priority teaching? A. Expect irregular bleeding initially. B. It prevents STIs. C. Weight loss is common. D. Take daily at the same time. Answer A. Expect irregular bleeding initially. Rational: Depo-Provera causes spotting and amenorrhea over time. Danger: clients who are not taught this may stop the shot unnecessarily. Memory click: Depo equals doesn't bleed. Question 20. Ovarian torsion. Q. A client with ovarian torsion presents with severe unilateral pain and nausea. What is the priority? A. Administer pain medication. B. Prepare for emergency surgery. C. Apply heat. D. Monitor vitals only. Answer: B. Prepare for emergency surgery. Rational: torsion cuts off blood supply and is a surgical emergency. Danger: delay causes ovarian necrosis and loss of fertility. Memory click: torsion equals twist in time. Question 21. Fourth stage labor. Q. A client in the fourth stage of labor has excessive bleeding. What should the nurse do first? A. Call the provider. B. Massage the fundus. C. Increase flow rate. D. Administer oxygen. Answer: B. Massage the fundus. Rational: fundal massage contracts the uterus to stop bleeding. Danger: a tony causes hemorrhage in seconds. You must act before calling. Memory click: bleeding equals ball up the fundus. Question 22. Ruptured ectopic. Q. A client with a ruptured ectopic pregnancy is hypotensive and tachycardic. What is the priority? A. Administer analgesia. B. Prepare for emergency surgery and fluid resuscitation. C. Obtain an ultrasound. D. Provide emotional support only. Answer: B. Prepare for emergency surgery and fluid resuscitation. Rational: ruptured ectopic is hypovolemic shock. Danger: internal bleeding can be fatal within minutes without surgery. Memory click: ruptured equals rush to OR. Don't forget to follow and tap the bell icon so you never miss our next En-Clex.